So is running bad for knee arthritis? So here's a study from the Netherlands that was recently published looking at 5,000 people where they tried to look at this issue. Specifically, they looked at these 5,000 people and wanted to see how they did with various exercises. And they found a few interesting things. To begin with, good news, no progression of knee arthritis if they were just doing low impact exercises like cycling and swimming. They then looked at this cohort of people and divided them up into three different sections. One was people who had a high level of muscle mass in their legs. Number two is moderate level of muscle mass in the legs. And number three is low level of muscle mass in the legs. And they found that in the high muscle mass and the moderate muscle mass levels with running, there did not seem to be any progression of arthritis. In the lower muscle mass group, in the legs, they found that there was a partial increase in risk for progression of knee arthritis if the individual was running or doing other high impact exercise. So what do we make of this? To begin with, understand that it's good news that low impact exercise does not seem to progress knee arthritis. The other thing is keep in mind that with this kind of study, this is not a study that is powered or set up to show whether or not running will progress your knee arthritis, all right? This is basically an observational study. So what this is telling us is that there may be a risk here and we need to do something about that. This is how medicine works, right? It's not always giving you 100% answers. It's giving you some thoughts and some risks. So for folks who are lower muscle mass or thinner, who are runners, this does not mean you're not allowed to run any longer. What it means is that just make sure you're also doing the appropriate leg strengthening exercises to help support your knees. Osteoarthritis is a condition of instability. What that means is that progressive instability from ligamentous injuries over years eventually leads to progressive damage and osteoarthritis in the knees. So running or other high impact exercise, make sure you're balancing it with the appropriate leg and hip and core strengthening exercises to help protect your knees. And continue to run. It's all right.